Now to a Target 12 investigators exclusive. State hospitals have had to divert ambulances more and more in recent months as COVID-related hospitalizations are on the rise.
People who continue to think this isn't a big deal, you just need to know that it is hurting people. If it's your child in an ambulance going to the hospital and they're diverted someplace else, how would you feel?
These diversions mean an emergency trip to the hospital may take longer than normal.
Target 12 investigator Tim White went to the head of Care New England for answers. He's here now with the exclusive details.
Diversions don't mean an ER is closed. The hospital still accepts patients who don't arrive in an ambulance, but we've learned hospital staffing has been a primary factor when turning ambulances away. Lately, the closest hospital isn't always an option for ambulances. This Providence Fire Department dispatch call from October illustrates the problem.
Is Rhode Island Hospital open and accepting?
Negative, they're on diversion.
We are all experiencing very similar patterns.
Dr. Otis Warren is the state's head of the American College of Emergency Physicians. He says unlike the first wave of COVID cases, hospitals are also taking in more regular patients again after elective surgeries were put on hold in the spring.
We're seeing not only high numbers of COVID patients, but high numbers of every type of other patient that comes in.
Target 12 reviewed ambulance diversion data from the Department of Health, which shows in August, the yellow line, there was an 82% increase in diversions compared to the same time last year. Since June, Kent Hospital in Warwick had the highest rate of diversions.
We don't like to divert. Doesn't help the community we serve. Doesn't help our patients.
Dr. James Finale is the president and CEO of Care New England, which owns Kent Hospital. He says staffing has been a major issue, exacerbated when healthcare workers need to isolate. He also says
the nursing homes are reluctant to be able to accept discharges now. So a nursing home patient of ours that would normally go to a nursing home may spend an extra 2 days in the hospital waiting to find a bed that will take them because of COVID.
Finale tells me they have beefed up staffing at Kent to reduce the frequency of diversions. Coming up new at 6, we ask the governor if she is considering canceling elective surgeries like she did in the spring. With the Target 12 investigators, Tim White, 12 News.
Now to a Target 12 investigators exclusive. State hospitals have had to divert ambulances more and more in recent months as COVID-related hospitalizations are on the rise. At 5, we showed you how staffing at hospitals has been a big part of these diversions.
And new at 6, we asked the governor if she's considering ending elective surgeries like she did in the spring to ease the strain on these hospitals. Target 12 investigator Tim White is here now with the exclusive details.
Hospital diversions don't mean an ER is closed. They still accept patients who can get there by themselves, but an urgent trip in an ambulance may take longer when the closest hospital is not an option. This Providence Fire Department dispatch call has been happening more and more in recent months.
Is Rhode Island Hospital open and accepting?
Negative, they're on diversion.
Target 12 reviewed ambulance diversion data from the Department of Health, which shows in August, the yellow line, there was an 82% increase in diversions compared to the same time last year. A trend the state's head of the American College of Emergency Physicians says is because hospitals are taking in more regular patients than they did in the spring.
We're seeing not only high numbers of COVID patients, but high numbers of every type of other patient that comes in.
We don't like to divert. Doesn't help the community we serve.
Dr. James Finale, the president and CEO of Care New England, says staffing and nursing home reluctance to accept patients discharged from the hospital have strained the system, but he does not think elective surgery should be put on hold like they were in the spring.
If we shut down if we shut down surgery, etc., it's going to put your hospitals in financial peril that we may never come back again.
Governor Gina Raimondo, who would ultimately make that call, agrees.
So no, the plan would be to allow them to continue their business. Frankly, the hospitals would go out of business if we don't allow that. And so the plan would be to use the field hospitals instead.
Finale says he thinks they are easing the bottleneck because he has been able to increase staffing.
But we are endeavoring to try to cut that to zero every day. I think you'll see a dramatic change from November 8th on.
Raimondo says the plan to dismantle the field hospital at the convention center is on hold as cases are on the rise, leaving 2 field hospitals in the state, but Finale expressed concern about the ability to staff those if they were activated. With the Target 12 investigators, Tim White, 12 News.